Handsome.
Alright, let's go see what we got. Chip, get some scrubs on. Alright, what do we got?
She's over here. Okay,
Good lord, what happened? Let's see here. We got multiple GSWs. There's one of the chest. There's one in the upper abdomen. God bless. What was the last set of vitals you got on there?
last vitals I got, BP was 82 over 52. Heart rate was at 138 and oxygen was 86%.
God bless. Chip, we're down the ER. Alright. Everybody started a bag of lactated ringers.
Yep.
Alright, let's get a second IV started. And let's go ahead and hang 2 units O negative. God bless, she's bleeding everywhere. That laceration on her throat's horrible as well.
Okay.
Alright, Chip, grab me an emergency crack tray. I gotta get us a better airway.
I did put a cup over the knife and taped it down, and then the GSWs are packed, so.
Oh, you're good there. I'll open those up upstairs. Let's get a secured airway in place first, and then we'll see what we can do from there. Thank you, sir. Go ahead and pop that open for me. I need that template scalpel, and I need the crack tube. And hand me those McGill forceps. Alright, on that second IV, get it as big as you can.
There's the scoop.
Thank you.
There's the tube. What was the last thing you needed out of this?
The McGill forceps.
Yeah, right here. There you go. That is an expensive thing.
Alright, so we're going to do an emergency crack on her. I cut into the cricoid membrane suction. Alright, there we go. Alright, hand me that crack tube.
Mm-hmm.
Thank you, sir. Alright, I'm in. Alright, give me a back valve mask.
What was that?
I need a back valve mask. We're gonna have to force ventilator for a little bit until we can get her stable enough I can get her on a ventilator.
Let me grab one. Found one. Here we go.
Alright, Chip, get up here and start bagging her.
Yup.
Bless. What the hell happened up there?
I have no idea. I arrived on the site. There was a motorcycle running with its headlights on, and she was laying under a cross. And there was nobody there.
That doesn't sound great.
Who the hell called it in? Was it a local?
The phone number I got belongs to Andrea Higgins.
Andrea?
Yeah. And as far as I know, these guys are friends.
I'm about to say, yeah. Oh, grab her real quick. We'll move to another bed. Give her the last one over here.
Running and swishing bag, if it's possible.
That does happen. Wait till we get to ride the gurney to the OR. Alright, let me get around this other side here. Has anybody called David?
I would just talk to David. There's another situation where Andrea's missing too, so they're looking for her.
Alright, grab me another set of vitals real quick. Alright, you can go ahead and hyperventilate her a little bit. Get her up to about 24, 25 breaths per minute.
Kidoki.
Listen to her lungs here. Is she having any difficulty breathing out in the field?
Not that I heard anything. I did put an O2 mask on her as well.
Trying to get it right, but I'm a little low still.
That's alright. Let that bag fully inflate. Squeeze it every 4 seconds.
Alright.
That'll get your respiratory rate up where you need it. I'm not hearing any lung sounds, and her heart tones are muffled.
Seems to be working when I do it for seconds every time.
You still feeling
got it.
resistance?
It's a little hard to push it down, but it's not
brother,
like
welcome to the stream.
too
Okay.
hard. I don't know if she's breathing with the bag or not. Never done it before, so I don't know exactly how it would feel if she is breathing back. Or by herself somewhat.
Alright, hang on, I gotta get up here to the chest. If you're meeting resistance, I'm not hearing any lung sounds, and her heart sounds are muffled. Then that's gonna lead you to
Just-
believe there's potentially a pneumothorax.
It just feels like I'm squeezing the bag. And it's not too difficult. So I don't think she's doing anything by herself yet.
Alright, I'm gonna do an emergency. Excuse me. And I'm gonna do a partial thoracotomy down here.
What does that mean exactly?
So, when you perform a partial thoracotomy, you go in from either side. Holy shit, there's blood all through here. Somebody give me some suction.
I'm just
Yep.
I'm gonna have to have some ABD pads as well. We're gonna have to pack this. She's bleeding everywhere.
alright. Want me to grab those?
Go ahead and swap her onto the wall ventilator there. Put her at 100% oxygen.
Okay.
Set it to 22 breaths per minute. got a few in this tray, but it's not going to be enough.
There you go. I'll get you some new ones.
Come on,
Where's it?
where's it at? Justin, hand me that set of forceps and that probe right there.
I'll put the spares behind you, right here.
The
Thank you, sir.
forceps and
There we go.
And that surgical probe that's laying right beside him, that straight bar.
there you go.
Thank you, sir. I gotta figure out where the hell she's bleeding at. Oh, hell. Chip, go ahead and prep us another 2 bags of lactated ringers. Pull 2 more units O negative. She's bleeding faster than we can get it into her. We're going to put her on the trauma infuser.
Mm-hmm. I'll go get the bags.
Alright, the lungs deflated. Justin, hand me a chest tube. I mean, she's small. Give me like a 6 French.
Or are these really heavy? I have them both here. Let me see. Did I hang them up?
Yeah, go ahead and spike them. You can piggyback up into the lines that are already going.
Mm-hmm.
Okay, I'm ready when you.
Thank you, sir. Alright, chest tube's going in. There we go. Keep that suction just like you got it, Justin.
There we go. Those should both be running now.
Excellent. Do not let those drop under about 25% full. When they get that low, hang the next bag.
Mm-hmm. Sounds good. I'll keep an eye on it.
Justin, attach your suction on right here to the end of this chest tube. Let's see if we can get that lung reinflated.
Sorry, could you say it again?
And pump that yonker off the top of your suction and hook it onto my chest tube here. See if we can get this lung reinflated and buy her some time. There's a lot of swelling around the pericardial sac. It looks like it's full of blood.
Got you some flowers, man.
God bless.
Damn. Yo, Logan's at the casino.
There we go. Lungs are inflating. Alright. That'll at least get us where we need to for the moment. Chip, hand me that needle driver from the cabinet over there. I need some 5-0 Vicryl. I'm gonna stitch this down.
I think there's still this one.
Got it. Hand it over here. Slowly.
Thank you, sir.
Mm-hmm.
Alright, that's gonna have to hold for the moment.
First bag's about halfway done, I think. Ish.
Okay, keep a close eye on it. If it's halfway through, you probably got about 2, maybe 3 minutes, and you'll need to change them. Just keep those bags turning over.
Mm-hmm.
Justin, get ready. This is fixing to get real messy. Alright, when I get into the pericardial sac, because we've got to drain this blood, it's gonna explode on us, okay? Hope you got a clean uniform.
I'm kind of happy I'm on this side now.
Oh, don't worry, you're gonna get
okay.
it too.
I'm gonna switch bags here. Go.
Alright, making the incision. Oh, yep, there it goes.
Oh,
Oh, Jesus. That's a lot of blood.
Yep, it's all under arterial pressure.
Would make sense in that case.
And she's got a hole in the left ventricle. Alright, hand me some 2-0 catgut suture.
Oh, jeez. What did I miss?
A lot.
A lot?
okay. Sorry. Which suture do you?
I need some 2-0 catgut. Need something that'll self-dissolve.
God, I love Danny's on calls. Ugh.
I gotta get this hole in her heart sutured.
2-0 cat cut.
Yes. And yes, it is actually made out of catgut. Thank you, sir.
That's interesting.
Yeah, never heard it before.
It's not very commonly used except internal suturing.
Is that purely because they dissolve by themselves, you said?
Mm-hmm.
Gotcha.
It's intestinal lining, basically, is all it is.
So, are you talking about the sutures that dissolve under your skin?
Mm-hmm.
I actually had a pair of those in Liberty.
Yo, I need some help.
Help with what?
You know the old dude, I don't know how he died again.
Oh, Jesus Christ.
Alright, I don't know if this is gonna hold. Chip, can you give me another set of vitals?
Mm-hmm.
She's losing a lot of color. Come on, Margot, give me something.
Bag's emptying pretty quick, too. So he's using up a lot of it.
It's literally running out of her as fast as we put it in. Ah, shit, she's cratering. Alright, Chip, switch her off of the ventilator. Take back up on that bag valve mask. I need one breath every 3 seconds.
Sounds good.
Justin, jump around on the other side. I may need you to do CPR here in just a moment.
Okay.
I swear to God, man. Danny's. I swear to God.
Justin, pop that BVM up for just a second and run the suction tube down that crack for me. See if there's blood
Okay.
returning in from her airway. Gosh, she's destabilizing fast. Okay. Justin, how many bullet holes did you have? You had 2 or... Got the one to
Pardon?
how many gunshot wounds did you have in total in the field?
2.
Okay. Why is there blood pooling behind her head?
3. Sorry.
Oh, Lord. Okay.
Okay, I'm connecting this to the Crike tube.
There you go. Just run it down nice and easy. I don't want her airway to collapse under the pressure.
Okay, hold on a second. I just don't know how to spell Crike.
Do it the cheater's way. C-R-I-C. Hey, how's it going? Sorry, y'all, I'm not watching the chat very well right now. I'm a little focused.
You need anything, sir?
That's I think
That's Chad, isn't it?
Yeah,
Is it
that's
Chad?
It's Chad.
Oh, what's up?
Hi, Chad.
Chad, you mind? There's a lot of blood. The white's gonna get covered.
That's fine. You know, sometimes I like polka dots. It's cool.
Okay.
All
Yeah,
right.
my shirt's pure red, I swear. It doesn't matter.
Well, I need hours, so I'll be back.
Uh-huh.
She is bleeding up underneath the dive. God bless. Alright, we don't have time to get her upstairs. Alright, go grab some surgical drapes. I'm just gonna open her up down here. Some of the big blue towels that have been sterilized.
I'll go find some.
Justin, can you take over on the back valve mask?
Yeah.
Just keep her ventilated. Alright, Charles, let's get a little messy in here.
Here we go. I have them.
Alright, just cover up everything except for her abdomen and her chest.
Okie dokie.
Alright, guys, if anybody's gonna have a weak stomach, I suggest you leave now. Alright. Then here we go. Justin, put your hand on the backside of this knife. I'm gonna get it out.
Okay, that should be good.
That'll work.
Take over the bag.
I'm gonna go put on
Okay.
my jacket.
I got the probe underneath it. Justin, very carefully. I need you to pull straight up. Alright, on 3, 2, 1, pull. There you go. Good. Alright. Cautery tool.
So cautery tube.
Yep, I need a cauterizer. Alright, God bless. That'll work, thank you. Alright, hold this suction for me. Alright, there we go. Come on, where's the bleed? It's too profuse to be venous. It's gotta be arterial. There it is. It's on the lower aorta. Chip,
Yep.
alright. I need you to do something for me.
Mm-hmm.
I've got to split her chest the rest of the way open, but I can't reach it without moving. You see the end of my incision line on this side?
The upper bottom side.
Right here, running just across the midline of her chest.
Yep.
Okay. Here, take this. Alright, you're gonna press down. You're gonna draw the scalpel in a straight line to you.
Okay.
Go all the way down to the bone. Hey, Scar. Actually, I do have quite a bit of medical experience from years past. I got out of it, sadly.
Keep it as straight as possible.
There you go. A little bit more.
Where do I stop? Tell me to stop when I need to stop.
Right there. You should be midline on the right side.
Mm-hmm.
Excellent. Alright, set that scalpel back down.
There you go.
Alright. Run and grab me a sternal saw.
Okay, I'll go grab. You said a sternal saw?
Yep.
Let me see.
God bless, she's slipping through all these APD beds faster than I can get them in.
Got one. The reason I couldn't find it because it's that small.
Alright. Take that sternal saw and right in the midpoint of the incision, you see the sternum?
Yep, I see it.
Alright, I want you to saw through.
Okay.
I've got to get her chest opened up because I'm going to have to reach in to get to the backside of the aorta. I don't know if this went all the way through.
Just a one spot, basically under the incision, I'm guessing.
Yes, sir. And then we're going to place a rib spreader and we're going to open up the chest all the way.
Okie dokie.
Alright, come on.
There we go.
There you go.
That's working.
Good job.
Almost through.
There you
That
go. Be
should
careful.
be
It'll bounce just a little bit. Hold it tight.
Yep. 2 hands.
You should break through now.
Got it. It's up.
Alright. Grab that rib spreader and place it in. It's pretty self-explanatory. Once it's in place, start turning the crank.
Mm-hmm. There we go.
Yeah, this suture's not gonna hold it from this side. Justin, will you grab me some 5-0 Vicryl and some surgical mesh?
Yep.
How wide do you want it? Because this is, I guess, decent enough.
Yeah, as long as I get my hands in there, we're good.
This should
Sorry,
be
it was
fine.
505 what?
5-0 Vicryl and some surgical mesh. Alright, Chip, we're gonna trade places, okay? Just hold your hands up in the air. We're gonna make this a real quick switch.
Yep.
You ready? Swap.
Almost good. Almost good.
Almost only counts in horseshoes and hand grenades.
That's true.
Alright, tilt that probe over this way towards me.
Mm-hmm.
Not too sure how to spell that.
Alright, here we go. Thank you. Justin, where's that mesh?
I'm not too sure how to spell the what is it? Vial?
Oh, don't worry about it. Just the suture will be fine. Just give me something.
Alright, here we go.
That'll work. Thank you, sir. And I think I just heard Kiwi go on duty. See if you can get her to come back here. I need another set of hands.
Okay.
Chip, hold this right here.
Mm-hmm.
Alright, perfect. Don't move your finger. Otherwise, you're gonna
Not
get
moving.
attached to her.
Don't want that.
Alright.
Yuki.
I'm about to go into surgery myself. What's up?
Oh gosh, I got a mess here. Multiple GSWs. She's got a laceration through the aorta. There was blood pooling into the pericardial sac. Left lung was collapsed. She's got at least 3 GSWs. One's to the back of the head. I don't know how bad the damage is, but there's blood coming out of it. I'm trying to repair the aorta right now, but I don't know if I'm gonna have enough hands to get all this done. She's losing blood faster than we can get it into her.
Okay, what do you need me to do?
If you'll trade with Chip for me real quick, we'll see if we can get this mesh secured.
Here you go.
Alright, I've got the mesh wrapped around. The cautery tool should be by your right hand if you can start cauterizing it.
Yeah, alright. Doing it right now.
Justin, will you give me another set of vitals? And Chip, go ahead and swap out the fluid bags and hang another 2 units O negative.
Yep. Sounds good. Sub one out.
God bless her. Blood pressure's still dropping. She's gonna crash.
There we go.
Alright, almost done. Just a little farther. We'll have this cauterized. Alright, come on, come on. There we go, that should hold. Awesome. Get these bad pads out of here. Alright, I'm not seeing any bleeding on this side. Kiwi, can you see anything on that side?
Not as far as I can tell.
Alright.
Again, still very messy here.
Come on. Let me get this clear. Alright, I think we're good. Oh. Okay, that's at least got the chest under control for the moment. Kiwi, you're a lifesaver. I appreciate it.
Of course.
We're gonna keep trying to get her put back together. There's gonna be a lot more bleeding. There's
Oh, I
blood.
feel she flatlines.
Oh, hell, quick. Justin, start CPR for me.
Okay.
Okay.
Go. Alright, Chip. Grab me an amp of epinephrine and a amp of atropine. Let's get ready to get medications on board.
Yep.
I'm gonna swap out her fluids again. There we go. Justin, you ever done internal compressions?
No, I have not.
Alright, slide your hand in behind the heart. Wrap your fingers up and around it. What you're going to do is squeeze the lower portion up just past the midline. Go ahead and pull those out and get them ready to get through the IV. Come on. on. There we go, just like that.
Okey-dokey. Maybe I'm gonna get behind you real quick here.
Mm-hmm.
Alright, Chip, go ahead and start with the epinephrine. We're gonna let this circulate for about 30 seconds and we're gonna check the monitor, see what we got. Come on, give us something.
There we go.
Alright, here we go. Let that circulate. Come on, just a little bit more. Okay. I've got trauma pads to control the bleeding coming from under the diaphragm for the moment. Just in hold compressions. See what the monitor shows us. Yeah, she's still pulseless, no electrical activity. Alright, Chip, go ahead and administer the atropine. Just resume CPR.
Which one was it?
Atropine, 1 full amp. Alright, next medications we'll switch to will be sodium bicarbonate and amiodarone. Be an amp of sodium bicarb, 300 milligrams of amiodarone.
There it goes.
Come on, Margot, give us something. Alright. Chip, go ahead and give an amp of sodium bicarb. Ah, she's still bleeding faster than we can get it into her.
There you go.
Alright, if we don't have something we can work with on this next check, I'm going to go ahead and open her stomach up down here. We've got to find the other bleed. She's losing too much volume. We can't stop it. Come on. Alright, hold compressions. Let's check the monitor. Still pulseless with no electrical activity. Alright, resume compressions for me. I cannot spell today to save my life. Alright. Here we go. Golly, there's a lot of blood in here. Where's the bleed? Where's the bleed? Come on. There it is. It's on the liver. Kiwi, will you grab that surgical cauterizer for me?
On it.
I'm gonna tilt the liver up, see if you can cauterize that closed.
Alright, let me know when.
Alright, can you see it now?
Yeah, I can see it. Let me find a better angle.
You can raise up a little
Okay.
higher if you need it.
Yeah, I'm doing it like this. Okay. You ready?
Ready.
Alright, starting now.
If it tries to balloon up on us, it's gonna be the hepatic artery.
Mm-hmm. Alright, almost done here. Alright, there we go.
Excellent. Let me pack this in with trauma pads here. Alright. And Chip, you might have to swap out that lactated ringers again. It looks like we're about down.
Yep.
Only about 150 cc's left in it.
I'll switch them around.
Alright, so we've given a total of 6 units of blood. She's had 4 liters of lactated ringers since she arrived at the hospital.
There we go. New money.
We've given epinephrine, we've given atropine. She's had 1 amp sodium bicarb. Chip, go ahead and give her a second atropine.
Mm-hmm.
Gotta get some kind of electrical conductivity back, because otherwise we're fighting an endless battle that we're not gonna win. And after that atropine, let it circulate, and then give the 300 milligrams of amiodarone.
What's the other medication you said?
Amiodarone. See if it can trigger any electrical conductivity in the heart. If it can, we can possibly get her back, but it's a long shot. And after amiodarone, we only have one option left, and that's Levafed.
No clue how you spell it, but I'll find it.
There you go, Chip.
Thank you. Tell me when to run it, because atropine might still be getting in the system.
Yeah, now we're gonna hold for about 10 seconds. Come on, give me some. God bless, these trauma pads are still soaking. She's bleeding somewhere else. Alright, go ahead and push that amiodarone.
Mm-hmm. Here we go. That one's in.
Alright, we'll let that circulate for about 30 seconds, and then we'll check the monitor.
Anybody on the radio? Anyone?
Alright, hold compressions. Let's see what the monitor shows.
So the medication I just pushed is supposed to help with her rhythm, right? Your heart rate, is it?
Yes, it actually helps to... still no pulse. Amiodarone actually helps to improve electrical conductivity as well. She's bleeding too fast, y'all. I'm about to run in the last of that O negative. Kiwi, you got anything?
Trying to, but I don't see anything.
The only other place that there could possibly be more bleeding would be in the head, but that pool hasn't changed. No
I'm
electrical.
gonna use the suction tool to get some more of a better view here. I'm gonna try and rinse it with a saline solution. See if we can at least see where the bloodstream is coming from.
There you go.
Thank you very much.
You want to continue compression?
Resume CPR. Because every time you squeeze, we're seeing more blood coming out.
Alright, I removed the excessive blood. I'm gonna now clean it here. Flush it with a saline solution. Then maybe we can at least see from which direction the blood is coming from.
He's got road rash. I don't know if she fell from her car or what. Where's it at?
I'm trying to find the origin of bleeding. Let me see what I can see.
Where is it? Come on, it's gotta be in here somewhere. Oh, good lord.
Don't see anything.
I found it, Kiwi. It's a superior mesenteric artery. It's shredded.
What are we gonna do? Do you think we can cauterize it or?
No, it's in pieces. There's nothing here to even put back together. Oh, God, that's why she was bleeding so bad.
Okay, what are we gonna do here?
There's nothing we can do. There's
There
no,
must be.
there's no vessels that we could craft that would be able to withstand the pressure.
Something artificial? Just something?
Let me try to clip it off at least.
How big is the piece of it that's broken?
If it's shredded, it doesn't matter how big it is. We would have to completely replace the shredded part.
The pressure to be working under, it's gonna be a damn nightmare trying to get anything to stay together.
But she gets, like, usually you can replace it, but
Mm-hmm.
Anybody able to come up to ICU 6?
Alright, I can get it clamped off. Alright. Clamps in place. Go ahead and hold compressions. Let's check a rhythm. We'll get okay, we kick that suction down here. Let's see if we can clear this blood up real quick.
alright. Trying to do it right now.
Justin, go ahead and hold compressions. Let's see what the monitor's showing us. She's still pulseless. There's no electrical activity. What's the time?
3:56 p.m. PST.
She's been down for over an hour. Justin, go ahead and check her pupils for me.
Come on.
If they're fixed and dilated, she's gone.
Come on.
Yeah, they're fixed and dilated.
We've done everything that we can. Time of death, 15:59. We did everything we could, y'all.
It's Margot, isn't it?
Yeah. Guys, we all just get her cleaned up a little bit and covered for me.
Yeah.
You guys have this covered?
I'll get everything sutured back up here shortly.
Alright. I'm gonna help Alex. He's seemingly freaking out.
Thanks for the help, Kiwi.
You guys have to leave.
I'm sorry, ma'am. It's just paying our respects to something happened.
Yes. Look, that's what I'm saying. You guys have to leave.
David,
Mm-hmm.
brother, I'm sorry. But your mom has passed.
The motherfucker that did this.
Her injuries were critical when my paramedics found her in the field. And once we got her up here, found out exactly how bad.
The sick son of a bitch posted this on Twitter.
I'm truly sorry, brother. Your mother was a great woman.
I know you did everything you could.
I wish we could have done more, but the damage that this person inflicted on her was just too far. That's beyond what we were capable to repair. We worked on her for over an hour. Despite all that, it doesn't make it any easier to lose a patient. The guys are gonna get her cleaned up, and I'll have her moved down to a private room here in the ER. That way you can have some time with your mom.
Thank you.
Alright guys, how we looking?
Almost cleaned up.
Alright.
Folks, looking at
Almost
the,
done. Yeah.
I'm gonna have y'all move her down to one of the exam rooms over here so that way they can have a little bit of privacy.
Yeah.
Okay.
I'll go prep the room real quick. Well, definitely not the procedure that I was expecting. But that was some truly wonderful RP on that one. This will work nicely. Lots of time on that one. Still hard to believe that Miss Margot is gone. Just repaired her arm a few weeks ago. But I guess go ahead and bring her in here. Just get her situated on the bed there for him.
Just looking through your eyes, it helps a little bit.
Oh, jeez. Oh, Christ. Oh, no, they aren't.
David, is anybody else gonna come up here to the hospital?
Well, the only other one that I know was that would have been around right now would have been Andrea, but the motherfucker that did this has her too, and he's not responding to me. She's not responding to me. I really don't know what to do.
I don't know on that one, brother. Is there anything we can do? We can call PD or...
I mean, yeah, I guess PD's gonna have to come down here anyway, right?
Yeah.
If you want to bring him down here.
Let me get him down. At least that puts more people out there looking for Andrea.
Yeah.
Because my fear is he did this to your mother. What is he gonna do to Andrea?
Well, I've already told him not to fucking touch her, not touch her hair on her head, and he let me know that he did exactly what I asked him to do. He scraped up her arm and he shaved her head. So he's willing to do this to her. There's no fucking telling what he'll do to her.
Yeah, we need every boot that we can out there looking for Andrea. Because if... I can only imagine, and especially now that he's proven that he has nothing to lose, and he's willing to do anything.
I just want to know what kind of sick bastard this man is.
I don't know, brother. Let me go get a hold of PD and get them to come up here. We'll see if we can get something rolling here. But you take as much time as you need with your mom.
And I don't know if you could put special request in, but Applejack and Wrangler were working the last time after. I mean, you remember when her arm was cut off and
Yes, sir.
she almost didn't make it. They were working on that the first time, and he just disappeared for a month. And he texted me today, and then all this shit started happening. So I don't know if you're able to tell them that I specifically need them to, at least, but
I can damn sure ask.
I appreciate you.
Not a problem, brother. We'll step out and give you some privacy. If you need anything, just let us know. Come on,
I
guys.
tried everything I could. I don't know where she is.
We'll give him just a minute.
Dang it.
You gonna make it there, Chip?
Yeah, sucks.
It does. Come on, let's go up front.
Yeah.
Oh, Lord. I wonder who all's working at PD right now. Oh, there's a mind reader.
Hello, Doctor.
How are you, Kevin?
I'm fine. We found this thing here. Callahan ran into it. I have no idea what that means, but I have an FIB agent here to take a look at it.
Let's take a look.
Oh,
Well, I was actually just fixing to call y'all on this.
Oh, okay. There we go. Hey, Jeffrey.
And Spencer.
And Spencer.
And DM.
And
And DM.
Alright, y'all,
Oh my god, Mr. Knight.
how are you?
Jeffrey.
Great. Do you guys have food? I'm dying.
Well,
I do actually. Here, come here.
Well, if y'all,
Something you'll love. Thank you all for coming. I gotta talk to you.
Oh, she's up in the OR.
I'll go tell her.
Would you let her know?
so wait, what happened with this?
We literally just found it.
Well,
What is it?
There's a heavy pistol and a note attached saying Margot's gun first killing.
Huh.
Sounds boring.
Margot.
I think I know what that is.
Margot
Do
Fallon
you know
is
what that is?
dead.
Wait, who's that?
Margot is dead?
Margot Fallon is dead.
Oh, Valen.
Right
Oh,
now,
wow.
or is that?
Yeah, we just got through working her. We worked her for over an hour.
Oh, okay. And somebody put this gun here, but oh.
You need to come in and talk to her son, David. Apparently, Andrea Higgins is also missing.
Wait, there's a note over there by that car saying Andrea's car, and that's Andrea Higgins' car.
Yeah.
What is this bullshit FIB has to go through, bro? Missing people?
Yeah.
Can never be me.
Well,
Cheese!
one is not missing.
Sorry.
One
Sorry.
is dead.
1 inch pinch is dead? What did you say?
I said, only one is missing. One
Your
is
voice
dead.
box is like really echoey. I can't hear much. Is it just me?
I hear it's fine.
Oh, it's fucking
It
me
is
then.
Andrea Higgins' car.
Hold on.
Yeah, I ran the plate.
What's going on?
Anything in it?
Mr. Knight, can you speak again?
Oh,
What would you like me to say?
Okay, yeah, I hear you. I hear you fine now. It was me.
Excellent.
Does your voice get deeper?
They have the heavy pistol.
Yeah, I haven't.
Oh, still as deep as it always has been.
Interesting, interesting.
Hey, Spencer.
Yeah.
You know, I'm coming in hot, man.
By chance, is Wrangler Applejack running around right now?
Not right now.
Okay.
Which Wrangler? Assume the bigger Wrangler.
Yeah.
Yeah, nothing around them.
Okay. If you want, I can take you back to David and Margot.
Are they dead?
No, David's just in with his mom.
Oh, okay. But Margot's dead.
Yes.
Oh.
Okay. So we have one person dead.
And one
Then-
person missing.
It says Marco's gun from the first killing. Whether or not that it was Marco that did it. Well, that confuses me. Okay. Do they have anything to tell us? I mean, I don't know what they would tell us is what I mean.
Well, apparently whoever killed Margot has been in contact with David.
Okay.
He's openly admitted to having Miss Higgins.
Alright. Where did you find Margot?
If I remember correctly, she was picked up in the mountains between... Oh, hell. She was south of Toledo. So if I can find the call, I'll show you the ping.
if on the call, that'd be great.
Alright, so all that we got was a 911 text that said, "Please help, my friend needs help. There is a man here and I am scared."
Would you be able to send a picture of that to me?
Yeah, let me get you one.
I'm going to my head real quick.
Post the stuff in data dump river. Love you.
Alright, did you get that email, Mr. Spencer?
Yes. Alright, I guess we will go in and talk to them. The last names on these people? What's Andrea's last name?
Andrea
Higgins.
Higgins.
And what about Margot?
Fallon.
112 is 41.
Alright, I guess we'll go talk to them.
Oh. Follow me, guys. I'll take you back.
Other night, he's here somewhere.
Hmm.
The dude, he just fucking checked in. He sent me a ping from like right in here. He's here.
Yeah, I was actually just walking these gentlemen back to you.
Green hair, black shirt, black pants. They said that he literally just checked in, and when I ran back there, he's not there. So this motherfucker's here somewhere.
Mr. Spencer. Hey, Spencer.
Yeah.
I don't know how many units you got here, but if that guy's supposedly here, if he went to the ER, he could have used the elevator to get to the second floor.
Yeah. Victoria and Callahan, are you still here? Can you look around the hospital for an individual with green hair, black shirt, black pants? Yeah, can you take a picture of that and run it? It's been there for a while though. I can't confirm that. So.
This is gonna be a fucking note from him, I guarantee you.
This is Andrew's gun.
Well, that's gonna be her combat list.
Mr. Spencer.
Is that Jeffrey? And label it?
Yeah.
Will y'all, check the windows on the far side of the ER?
Say that again?
Will y'all check the windows on the far side of the ER?
10-4, we're on the way.
You're right here.
Sorry.
Which room?
To the hallway, accidentally. Yeah.
Windows on the far side.
Is it just that one side?
Yeah, it's just that one side. That's the only place you can really hide down here. But that elevator gives immediate access to the second floor.
Yeah, I guess we can look there.
Kiwi's in the OR. I'm gonna check on the OR crew, guys. Everything up here should be locked, with the exception of the pharmacy, and then the stairwell just goes down to the main lobby. But I'm gonna go to the OR real quick and check on them.
Who's the one we need to talk to? Or where do we need to go to talk to the person?
I got a
who needs to talk to us?
The gentleman I was talking to, that's David Allen, that's her son, that's who you need to talk to. But auscultation room 3 in the ER hallway.
Just right in the parking lot.
Helps if I go to the right damn floor.
Dr. Knight?
Yeah.
You and... she's the ICU. She was with Kiwi earlier.
Oh, okay, perfect. Will you
Everybody
go?
finished up her surgery? I'm not sure.
Alright, I'm gonna check up here just to be safe.
Sounds good.
Sopa. Nope. Have a good night.
Um, wait, is the
Hmm. Now I'm just very curious as to where our person possibly is going. Yeah, I'm upstairs. What you got? Yes.
So her vitals just jumped. Her heart rate is pretty high right now.
Alright.
I'm
What
not
changed?
too sure why. We were just standing here talking, and then all of a sudden, the numbers just started climbing.
Okay, did she try to move or anything prior to that?
Nope.
I don't see any movement.
Well, let's go
I
ahead.
know earlier Juniper did come in. There's a report. Her BP and her heart rate went up, and she administered.
It should have been just the ICU ordered
Yes.
medications.
Well, it was that, and then her ICP went up as well. And then she administered Rhizofin, 250 milligrams, mannitol, 250, and dermal, 150. There were no signs of infection or anything, so.
Alright, well, let's see if we can get her blood pressure down. She has no allergies, so let's go ahead and give her a 10 milligram dose of morphine. Especially since she's just been resting, it's either going to be ICP or pain. So we can check her ICP, but let's get some pain medicine on board first, because even if it is the ICP, the morphine will help to reduce the swelling.
Okay, so you said 10 milligrams?
Yes, sir. And once we get that on board, we'll take her down. Let's do another scan just to be safe.
And through the IV's perfectly fine, right?
Exactly. You gotta remember that the IV makes it the fastest into the body.
There we go.
Alright, let's give that just a moment, and we'll check, see if her blood pressure and pulse rates come down a little bit. Red light, that's cool. There we go. She's coming the right direction. Excellent. Justin, would you mind taking her down, doing a CAT scan for me?
Yep.
PD to EMS, you're cleared to come back.
Pickle and David in the waiting
Oh,
room
oh.
downstairs.
I'm not sure where Pickle is, but I think David's downstairs.
Okay, I'll go tell him. She's
yeah.
on the CAT scan.
Yeah, David was downstairs, so...
Okay.
Should be on the second floor.
Let's go see if we can find him. And, just let me know when you get those results.
Oh, there.
Yeah,
Okay.
kind of does that sometimes.
Well, there's a lot to tell you. I'll go over that here in a
Just
minute.
just a moment.
Fun times, right?
Yeah.
I guess I
As
don't
long
need
as you
to
can- we have
put in
pictures of
notice.
tweets,
Yeah.
just so you can process
Lord.
Since you, along with the number with the maybe picture.
Yeah. Well, I've got him saved as bitch made.
sorry, y'all. I wasn't paying attention on the chat.
Dr. Knight, I love you. I just got a call. I gotta respond to that call. I'm so sorry. I love you. You'll be back here in 10 minutes. Please, right? You're here in 10 minutes, right?
Wait, what I miss?
I need to respond to a call, but you're here in 10 minutes, right?
Yeah, I would imagine I would be here, so...
Perfect.
112 to 76, latest 71.
Yo. How's it going? Yes, sir.
So her CT scan came back normal, I guess. There was no changes on it at all.
Okay, how'd the swelling look?
Pretty much the same.
Damn, it should have been reduced now. Oh, well, I know Kiwi's in surgery at the moment, but let me... I'm gonna send her a message and ask if she can follow up with her.
Okay.
Because I'm really believing it's gonna be something with the head that's going on, and we should have seen the swelling change now, especially with that much mannitol. So, I gotta figure out exactly what is going on. We may need to do a high contrast CT or an MRI to get a better idea, but we'll see what we can figure out.
Okay.
Alright, well, we'll just put her back in her room and let's put her on Q-hour vital checks.
Okay.
And then as soon as Kiwi gets out of surgery, I'll see if she can stop in and just take a look at her.
Okay. Okay. Sounds good.
Thank you, sir.
Thank you.
You are very
Oh
welcome.
my god. Ow! I'm gonna fucking die because of you. Fucking loser. Oh, hi.
Hello.
The Victoria. Oh,
How's
hello.
it going?
Everything okay with those two? God, young love. Am I right?
I'm guessing.
Where'd be a good place to wait around for Ruby's surgery to be completed?
Well, I would honestly say the second floor waiting area. It's a little quieter than it is down here. Or there's a little sitting area at the end of the ICU hallway.
Okay.
At least with the ICU hallway, you'll hear them when they come up.
Yeah. Alright, thank you very much, Doctor.
You are very welcome.
What? Bro, I'm fucking sick. I can't tell you. Oh, hi, Victoria. I feel a little better today. Oh.
Dr. Knight, are you available?
Alright, there you go,
I
buddy.
have like a lot.
It's a team up.
What are you doing?
Thank you. I will.
I
will.
honestly,
Honestly, yeah, I'm trying not to strain myself. I've been taking breaks here and there. I promise.
Mm-hmm.
Bye, Victoria. Have a wonderful day.
Oh,
Thank you, Jason.
I was doing work related things.
Now, Timo, what were you all ecstatic about?
What was I so ecstatic about?
Yes, you were all excited.
Okay, but you arrived. That's what I was so ecstatic.
Thanks for your help, Dr. Knight.
I just love seeing you.
I have a patient up in ICU 1 with 2 gunshot wounds in her abdomen. 4 to 5 inches deep.
Oh, lovely.
Yes. I can bring you up there to see her, if you're not busy, that is.
Well, I was actually fixing to fly out.
Oh, I mean, you can if you want to, but, you know.
Already got one DOA to write up.
Yeah, I heard.
Who's the patient?
Akemi Yamada. Posted her ICU report if you need to take a look.
Oh, I'll take a look when we get up there. Is she still conscious, or?
Unconscious. She was unconscious even when I arrived.
Where'd you find her at?
Garage C.
Okay.
I have her on a bag full plus blood because she was indeed laying in a pool of her own.
Is she O positive blood type herself?
Yes, I found a blood type card.
Oh, okay, good. Alright, so 2 GSWs to the abdomen. All right. Got them nicely packed. And did you already take her through for imaging?
Yes, I did.
All right.
Nothing came back for her head in the MRI, and the bullets aren't puncturing anything in her stomach.
Excellent. So
Nearly punctured the stomach. Nearly messed up. Super close.
yeah, that's a good thing. Well, in that particular case, just so she doesn't have lead running around in her body, let's take her up to OR2 and I'll get her prepped for surgery. We'll just go ahead and get the procedure done.
I can, I'll scrub it as well. But, to be fair, I've only seen OR1. I don't think I've seen OR2.
Oh, we actually have 3. We've got 1, 2 in the hybrid. I usually do surgery in the hybrid.
Yeah.
All right. Well, let's get her upstairs, and I will meet you upstairs.
Yeah, I'll go scrub it.
Oh, there you are.
For some reason I'm missing my mask. I'll have to fix that.
Well, wrap yourself with a surgical towel if you have to. Alright, if you'll go ahead and get her on the monitor and prep her for a king airway. We don't need to do a full endotracheal intubation. And I will be thinking really hard for just a moment. Alright, y'all give me just one moment. I'll be right back. All right. All right, sorry about that, Joe.
It's no problem, Dr. Knight. Here, I'll swap areas with you.
Actually, it'd be a little easier if I got over there.
Okay.
All right. So what'd you get accomplished while I was gone? Hey, Electra, welcome to the stream. I do appreciate that. It is my all-natural voice that you are hearing. All right, did you get everything prepped and ready for us?
Yes, I did.
All right. Well, I will give the medications if you will get ready to do the King Airway placement. All right. Let me know when you're ready. Alright, starting the automatate. Oh, my music changed. Sorry, y'all, wasn't paying attention to it. There we go. That will be a lot more fitting.
I'm good when you are.
All right. And the automatate is on board. I'm administering the succinylcholine. Actually, I can just do. Oh, actually, I forgot they changed that. Haha, haven't used this in a while. All right, there we go. Sucks is on board. Go ahead and open up the airway. Now with that King airway, you're just going to slowly advance it. You don't have to use the laryngoscope and everything else like you do with an endotracheal.
Okay.
You're going to guide it down the back of the mouth into the throat. And you'll feel just a little bit of resistance when it comes to contact with the vocal cords. Alright, you should be feeling the resistance.
Yep. I do.
Okay, good. I did inflate your cuff. Excellent. Alright, let's go ahead and put her on the ventilator. And we'll put her on a 60-40 mix of room air and oxygen. Alright, and let me know as soon as you got the ventilator set up. We'll get started.
She's on the ventilator.
Excellent. Let me mark the surgical site and we'll spread out the betadine. There we go. There's blood oozing back through that bullet wound. Pulse rate's elevating. Alright, well, this is gonna be an on-the-fly one then. Hand me an 11 blade, please, sir.
There you go.
Alright, making a midline incision. Cutting through the dermal and epidermal layers into the subcutaneous tissues. Right, there is the greater omentum.
I'm just checking on you guys. Hi.
Oh, hey there, Anna. We're just doing a recovery on a couple of bullets, but we gotta figure out why we now have some bleeding going on that we didn't have just shortly ago.
Awesome. Yeah. I just came on duty just to check on ICU patients, pretty much.
Excellent.
Came to ask to be doing like normal. I'm assuming those surgery rooms are ICU patients.
There's actually been nothing but surgery in ICU today. Let me get the omentum opened up here.
Which room is this one?
This is OR2.
I meant which patient is this for room?
Akemi Amada, I just took her intake.
Ooh, okay. I didn't mean to interrupt you guys.
Oh, no, it's fine.
Ah, you're fine. Okay, let's see here now. So there's the large intestine, there's the liver.
Well.
Okay. Her heart rate is rising.
Alright, let's see here. Elevated heart rate. We are going to have us a bleed in here. The question is where? Will you go ahead and let's hang a bag of lactated ringers, 1,000 milliliters, and start it wide open for the current moment. And you treated her with type-specific blood, correct?
Yes.
Excellent. And let's go ahead and order a bag of platelets just to be safe.
There's 1,000 milliliters of lactated ringers.
Alright, let me just search around, see what we can find. I would imagine, based on the location of the entry wound, it's going to be right here in the area of the liver, the gallbladder. Let's see here. Take a closer look at the liver. there's a small pool right there. Would you hand me a surgical probe, please? Thank you, sir. So one thing I learned when I was in the army, you can use surgical probes like halide bars for organs and not cause damage. Alright, let us see here. Bit of bleeding. Where are you coming from? There you are. Okay, let's see if we get a better angle on this.
Scan must have missed the kidney.
And it could have actually occurred after the scan. Because think about it, both of the bullets were still in place. They could have shifted during transport. Alright, and we have me a pair of McGill forceps, please. Thank you, sir. Alright, let's very carefully gonna maneuver in here. It's a fair-sized chunk of land right there. But I don't. Doesn't look quite the right size to be a rifle round. Maybe a large caliber pistol. Alright, let's see here. There we go. And let's very carefully see if we can get this out here. Here we go. You know, it just flattened out really well. You know, that's probably not more lead than maybe possibly a 9mm. It may be a 10 or something, I'm not sure. I'm a damn doctor, I'm not no forensic expert.
That would be Petey's job.
That's why they make the big bucks.
Oh yeah.
There we go. Set this off to the side in case Petey wants it later. see what kind of damage we're looking at on that kidney now that bullet's out of the way. Okay. Looks to be pretty clear as far as damage or debris. We'll rinse the area. And we'll see if we can get this sutured back together. Alright, would you hand me a 20cc syringe full of sterile saline, please?
Alright, yeah, I got you. How big do you want the needle to be, Dr. Knight?
Oh, no needle, I just need the syringe.
Alright.
It just makes it a little easier to be more precise.
Makes sense. Alright, here we go.
Thank you, sir. And if you'll have suction ready, please.
Alright, I'm ready over here.
Alright, just let me get this rinsed out here. There we go. You know, she's actually very fortunate that that was a clean through.
Yeah.
Looks like her heart rate is coming back to appropriate levels.
That's good.
Monitor showing about 100 beats per minute. I can definitely work with that.
Yep.
Alright, and let's get some sutures going here. Would you prep a needle driver with some 3-0 Vicryl, please?
Here you go, Dr. Knight.
Thank you, sir. Oh, she's trying to come up out of the anesthesia. Go ahead and administer a 500 milliliter dose of propofol. Yeah, I gotcha. Alright, we'll give her an initial of 250 milligrams.
Did I miss something? That way we're giving her full.
Looked like she was trying to come out of the anesthesia. She had clenched up on her hand. I saw her arm contract. There we go. That's much better. Alright, Pinky, what's going on? No, not while I have somebody split wide open. We do not want that. I prefer my patients to be comfortable. It's bad enough they're on my table. No need for them to be in pain or to suffer. Alright, and we'll just slow drip the rest of this just to give her a little extra. Alright, and now let's get started on the suturing.
Alright.
utilizing a good old cross stitch. It ought to hold nicely. Want to make sure that we maintain optimal blood flow through this kidney. Doesn't appear any arteries were affected because the bleeding would have been substantially worse. Keep an eyeball on her vitals for me. Heart rate spiked just a little bit. Nothing to be alarmed about, but let's be mindful.
She did have a through her chest.
We'll take a look at that one as soon as we get this addressed.
Okay, her heart rate went back up.
Excellent. And still keep an eyeball just to be precautious. And that should hold us. Alright, let's just clean this out a little bit here and make sure we don't have any residual bleeding. Alright, let's see what we got now. No residual bleeding, get everything realigned. I love that OC chat some days, it's quite entertaining. Alright, everything's looking good here. Let's get the kidney set back into proper position.
Alright.
There we go. Alright, get this probe out of the way. And just to confirm, you said she had 2 GSWs or 3?
3, but one was through on her chest.
Excellent. Alright, well, just so I don't have to make a big mess, let's move over just a little bit here and see if we can locate the other one in the abdominal area. Alright, let's see what we can find here. Alright, let's see. Alright, checking the area around the stomach. Oh, wait a second. There it is. So let me see if I can get a better. Oh.
No need to. If it goes up more, then you start to worry.
Yeah, but still, always want to be very conscientious about what's going on with your patient. But hey, you don't care about the little things as the day somebody dies.
Yeah.
Alright, let me see if I can get this into position here.
Alright.
There we go. Alright, now let's see if we can get these millers in there. Oh, yep, it's gonna have a jagged edge. Let me get this out quickly.
Okay.
Alright, I'm gonna ease this back here. Be ready with suction just in case. And you might even have a trauma pad handy. Alright, let's see here. There we go. Yeah. Alright, good. Move that suction up closer. Alright, let's find the source of this bleeding. Alright, it's not too heavy, so it's not arterial. The real question is, where are you? It did have a nasty jagged edge. Alright. Yeah, would you grab that cautery tool from the tray beside you there? See if we can get this all nice and cauterized. Right, just tap here, see if we can get this under control. There we go, slowing down. Looks like we may have caught just the edge of that dorsal vein.
Her heart rate is going down.
Excellent. Oh, is you out there breaking the hearts there? There we go. That should do it. sure we haven't missed anything. I love interactive patients like this. It makes it so much more fun. And to be fair, I did warn you that it would be the most heart-wrenching emotions ever, and it just makes it so wonderful. Alright, we are looking good. Let's just get this cleaned up. Right, we're looking nice now. Alright, would you go ahead and prep me 2 needle drivers, please, sir?
Sure thing.
We'll do 5-0 back roll. You alright there?
I gotta drink something real quick, or else I'm gonna go down in the OR.
Yeah, I'd prefer you not do that.
Yeah.
Let's make sure to re-scrub and put some clean gloves on, please. Alright. Alright, get the momentum put back together here. The one nice part about the momentum is you don't have to suture it. You can actually just tap it with a cautery tool.
Are you good in the mines?
10-4, walking on now.
I've got 3 in my helicopter, so I'm gonna make a quick trip to the hospital. I'll be right back.
Alright, that should hold nicely. Alright, let me get these muscles put back together.
Alright.
You know, a lot of people ask me if I am actually a doctor, and I am not. By trade, I'm actually a cop. So, I tend to break more people than I fix, but it is what it is. But I do have a very large, random set of skills, and I spent many years working as a trauma technician, a physician substitute, and several other medical-related positions. So, I do have quite an extensive medical background, which comes into a lot of play. Actually, once I had a recommendation letter and a dream to go to medical school, but never followed through on it. There we go. Alright, now just need to get this skin put back together. Yeah, and actually my first character on Legacy was Silo Knight. He was my cop character. Silo is actually me. And the way I ran him, he had my life experiences and all of my skills and knowledge, and then as I advanced through that, I decided I wanted to start a second story, so I created Shilan. And Shilan is my dream character. He's the things that, looking back now, I wish I would have accomplished, but everything happens for a reason, so I figured, I can help people create beautiful stories. Alright, almost done here. Oh, Lord knows I ain't perfect, but I do try. My little stinker is awesome. Bad part is she's really cute and she knows it, so she does tend to get her way, especially with Dad. But it is what it is. Still my greatest and proudest achievement in this life. Oh, Marco getting buried with a crap ton of acid and alcohol, huh? And that should do it. There we go. And since we're already here, let me take a quick look at this through and through.
Knock, knock.
Back to
How's it
join us.
going?
Oh, we're just about done. I just closed the abdomen. Can I double check this through and through real quick on the chest, and we can get her back to ICU.
Nice. Between Ruby just got finished with hers as well.
Oh, excellent.
So-
How did it go?
I don't know yet, but I was just told to shut up about it. Besides, put the patients out, so I'm not worried about her spreading anything.
Alright, let's take a look at this here.
But yeah, I was just coming to tell you guys to make sure you guys are good.
Oh yeah, once we finish up with this one, we'll get our patient back to ICU, and I don't see anything here that would require any further attention. Just make sure to keep it cleaned and covered for her. Alright, well, let's get this young lady moved back to her room. And we'll stop the sedation.
I think you should be good. There's one in the hallway right now. Besides Victoria, but she's on the way in at room 10. So.
Oh, she was already in her room.
Yeah. I was just letting you know so if you're wheeling the patient up there, you won't run into people too much.
Oh, I just do it like I did when I was in the army. You'll make a hole and people magically move.
Alright. Have fun.
Alright, I'll get that sedation off and put her on some IV fluid. Just to give her a little bit of support. Alright, and if you go ahead and deflate the cuff on that king airway, we'll get that pulled out and put her on a nasal cannula.
So.
There we go. Alright, sir, that is that. If you'll just gather everything up and move her back to her room, I'd appreciate it. I will check in on the patient later, and I've got to go take care of a few things in my head, so I'll be flying out for just a little while. Send me an email or page me if you need me. All right. Well, nothing like a critical case in the ER, and then good surgery and OR2 after that.
I see you.
There we go.
Holy shit.
That's still just so much fun to do. Dear Jesus, in like the last 2 days, I've made like 50K on duty. Good Lord. I need to get a life.
Hi, Dr. Knight.
How's it going?
It's going pretty good.
That's good. Oh, let's see here.
Excuse me, sir. Are we good? Am I good to transport the body to the morgue?
Yes, as soon as once PD's finished up everything they needed and the sunset had plenty of time, then we're good to take her to the morgue.
Okay, because yeah, David said that they're pretty much done inside now. So
awesome.
And PD's gone, I think.
Good deal.
Hey, David.
Yo. Great to see you again tonight.
If you need us
This
to
might be your last, but I love you,
in any
man.
capacity,
If you see you again, you gotta let
we
me know.
have full therapists that could
You got
assist
on?
with that, okay?
But if you do,
I've got Kiwi's numbers. I've got like multiple people up here. Phone up here's number, so if I'm just gonna take some time to myself, you know.
No, I understand that. Please don't do anything stupid.
Oh no, I'm not.
Hey, David. If you need somebody just to sit down and vent to and drink a cold beer with, I may not be no therapist, but I'm damn sure good at listening and I'm good at drinking beer.
Oh shit.
I appreciate you. And again, I appreciate everything you've done.
Yo.
You've done everything you could
Whoa.
for.
Okay.
And I appreciate it.
Thank you, Dr. Knight.
You're very welcome.
I know it never gets easier.
It never does. And like I said, your mom was a great woman, and I'm very sad that she's no longer with us.
She was a hellraiser.
You know, I've heard that from a lot of people, David, but every time I saw or interacted with her, she was always so kind and sweet and soft-spoken.
Oh yeah.
Yeah, I'm God. I hope you fucking chill.
Jesus. I don't know what that was about.
Nope. Hopefully everything's alright in there, but...
Doing some scans and stuff.
You know, I say it's not my business.
Uh,
Whatever they got going on, you know.
You.
I'm gonna agree with you on that one.
Hi guys. Bye guy.
Alright, bye.
Do you know if the PD's done with the questioning or not?
I mean, they asked me everything they needed to, and
Just
Yeah, I'm sure they're done by now.
They pulled FIB for this
Especially with
immediately,
the
so.
amount of times that
You actually ended up with the director of FIB.
Oh yeah. I figured that out real quick, and I'm like, oh shit.
So, has there been any word on Miss Andrea?
There's not. The only thing we know is, I think you were the one walking in with the cops, right?
Yes, sir.
So, while I was in there with her, he sent me a ping from right there, like right where Justin's standing, and he had left a gun down there with a note that said Andrea's gun. He's told me that he's got her and that we won't see her for a while. So that's giving me hope that she's alive. Just because he thinks that we won't see her for a while doesn't mean that we're not gonna.
Right.
I'm gonna make sure of that.
Well, when she is found, if she is in need of medical attention, regardless if I'm on duty or not, please have the staff set a page out for me.
Will do.
He's already taken one precious life from us. We don't want him to have the opportunity to take a second.
Well, I'll be honest with you. I'm not gonna give him the opportunity to take anybody up. I refuse.
Well, David, you know, I started my life in the Army, so I very much understand. Brother, all I'm gonna say is be careful and watch your back.
Oh yeah. Oh no, don't worry. There's a lot of people right now, very upset. There's eyes everywhere. So my thing is, he just better hope FIB or PD.
Oh, like you said it. Damn.
Because I saw what condition she was in when I got here.
Yeah.
And like I said, that tells me this man is sick as shit. There's something wrong with him.
Well, personally, I think whoever finds him first needs to ensure he has a really long walk off a very short cliff.
You know.
Frankly, I'm gonna say it. The butcher needs to get him.
The butcher.
Oh,
that's something
I'll be honest with you.
in a long time.
Yeah, I don't think the butcher's around anymore.
The butcher's gonna look like shit compared to what happens. Trust me.
Wish.
It's not gonna be good. It's gonna be
Jay,
bad.
please don't go off the deep end on this one. I was literally about to text you to see how you were doing today, because I haven't talked to you forever.
I was doing fine.
Yeah, we were all fine upstairs, and then she dipped.
I love pulling
Like, she was gone
heartstrings.
doing
That's what makes it
something,
all
and then
worth
my
it.
mom dipped and shit.
Yeah,
What I'm
man.
assuming is the only reason she
Yeah.
left privately is I'm guessing he must have had her phone and sent a ping, and that's why she dipped out like she did. Because if it would have just been some random number texting her, telling her to come somewhere, I know her, she would have done it.
Right.
At least I hope she would.
I doubt that she would have. But yeah, I'll let you get to it. But like I said, brother, if you need something, you got my number. Just call me.
Absolutely.
Even if
And
we need
again,
to.
thank you for everything you've done.
Of course, that's what I'm here for. Maybe one day I'll figure out how to save them all, but sadly I didn't today.
I guess I'm gonna head to her house and start looking through her stuff.
Who knows, maybe you'll find an answer that can get you a little closer.
Well, she left everybody a note, which just tells me
She knew this was coming. Is that
well,
what you're basically getting at?
it says, when you see this, I probably won't be alive anymore. I know that I'm being followed and watched. I know something's gonna happen very soon, and I'm scared of it. That's the first line. Hey, Mikey. Yeah.
I've been gone out of town for a good day, and I just wish that I come back to. God damn.
One of those things that's out of our control.
Yeah. We're fixing to leave from here. I'll get that, and then I'll swing out.
Had I known it was a surgery day, I would have been in city sooner.
Well, there's been 2 surgeries today, one critical in the ER.
Alright, be careful.
Missed it the other night. I did 4 or 5 surgeries back to back.
Bro, I was trying to save for that, but I had a
gotta
Liberty
go get
work in the morning,
an
so I
advance
couldn't.
and take it to Mikey.
Appreciate you three.
Y'all be careful. Let us know if you need us.
Will do.
Please think about what I said, Jaden.
I will. Appreciate it.
Okay, so I guess I'll transport the body to the morgue then.
Thank you. I gotta go take care of a few things in my head, y'all, but I'll be back later tonight.
Also, I'm writing a DOA, right?
If you will just put in the initial DOA, I will attach my report to it. That way you don't have to write it all up.
Okay.
So just...
Yeah, well, mine would just be from when I found her to when I got her to the hospital.
Yeah, if you just punch it in, and then I'll attach mine onto it shortly.
Okay.
It's good work today, y'all.
Hi, everyone.
How are y'all?
Hello.
I've been focusing on ICU ward, so making sure these patients are good.
Excellent.
And how lonely it could be.
Oh, and actually, since you're doing that, I will say keep an eye on Miss Betty for me.
Yeah, she's asleep right now. Or she's with the local doctors doing tests or something.
Ah, okay, perfect.
Mm-hmm.
Yeah, I did,
Otherwise, I would be up there, you know.
Hello.
Are you guys done with, that patient?
I mean, He's in her room just resting. She has her ECs there.
Okay.
You can go get my ammo.
I'm gonna go sleep. Y'all call me if you
Alright.
need me. Oh, well, that was one hell of a day. Sorry for the rapid, go live that I did today instead of my normal, chill. Hey, okay, we're getting started, but it is what it is, sometimes you just can't help it. But, one of those deals. I greatly appreciate every one of y'all jumping in and watching the streams. I hope y'all greatly enjoyed it. Let's see here. Who would be somebody good to raid? Hang on, do I not have anybody online right now? I do not. What the heck? Well, okay, I guess I take that back on rating. Sorry, y'all. I will call it an end for here. I will try to get on and stream later tonight, but we'll see how that one goes. But until I see y'all again, be safe. I'll see you on the next one.